Hello and welcome to UKFitnessHub.com. My name's Travis Tarrant, and in today's video we're going to be looking all at ulnar nerve transposition surgery. We're going to be going through what the ulnar nerve is, what it does, why people need ulnar nerve transposition surgery, and finally we're going to be taking you through a whole transformation process from day one all the way to when you're back to full health and recovery after the day of your surgery. Finally, to wrap up and conclude the video, I'm going to be answering the frequently asked questions that I get from clients and patients alike who come to me to rehabilitate their ulnar nerve transposition. Let's get into the video. So firstly, what is the ulnar nerve? The ulnar nerve starts in the spine at spinal roots C8 and T1 and is a continuation of the medial cord. The ulnar nerve descends underneath the clavicle, then down the medial aspects of the arm. At the elbow, the ulnar nerve passes through the ulnar tunnel, which is a small space between the medial epicondyle and the olecranon. At the forearm, the ulnar nerve pierces through the two heads of the flexor capri ulnaris before passing through Guillaume's canal into the hand and innervating the pinky finger and ring finger. So why would somebody need to ever get an ulnar nerve transposition surgery? Now, I myself have had ulnar nerve transposition surgery twice, and I've rehabilitated around 15 individuals of varying ages and varying reasons of why they've had the surgery. So the first and most common reason is cubital tunnel syndrome. So this is pain and weakness at the elbow. It can spread to the hand or as high up as the neck and shoulder. Typically people get pins and needles. When they grip things, they don't feel like they have any strength. Electrical impulse pain and sharp pain that can come down the neck and all the way to the pinky finger. So that's reason number one. Reason number two is subluxation of the ulnar nerve. And all this means is when somebody bends their elbow, the ulnar nerve pops over the medial epicondyle, and then as we extend, it pops back. Typically, this doesn't cause any pain, but for people, for example, that are tennis players, rugby players, anyone that's interested in sport, it can cause more of an irritation, and it's something where cosmetically people want to have it done, especially for throwing sports, where the elbow joint is put through so much force that those injuries tend to happen quite quickly if they're unlucky or they've got a shallow socket at the elbow joint. Finally, when somebody has major trauma, it can be, for example, inflammation at the elbow joint, or it can be arthritis, bone spurs. That can then compress and rub on the ulnar nerve, in which case the ulnar nerve needs to be released. So what happens when we release the ulnar nerve is typically we're putting it from that groove here that's in between the olecranon, which is your elbow, and the medial epicondyle, which is the pointy bit just on the side here of the inner arm. What happens is we remove it from there and we put it to the front of the forearm, okay? So that is the new position where it would be just at the front of the forearm. If you're either thinking about having the surgery or your surgery date's coming up, it's worth asking your orthopedic surgeon if you're going to have a submuscular or subcutaneous surgery. These are the two main types of surgery that are done for ulnar nerve transposition. So unless something new comes out after this video or there's a new medical advance, you'll be getting one or the other. So I actually had two subcutaneous surgeries, and let's just go through what this difference in name means and what the difference in the surgery is. So let's start with submuscular. Sub means below, and obviously muscular means muscle, right? So if you're going to take the ulnar nerve from where it's situated at the moment to the front, what happens is they detach the pronator teres muscle, and then they put the nerve underneath, and then they reattach it. So that's submuscular. Tends to have a higher success rate, but there is more trauma involved in that surgery. So for people that want to heal faster, subcutaneous is the better surgery. Submuscular tends to be a little bit, just fractionally more successful. And the reason is you've got that extra layer of muscle over the actual nerve itself. Now, subcutaneous is where it's on top of the muscle, and they use a fascial sling, and essentially they put a bit of connective tissue over the top of the nerve in that position, and then that connective tissue over time creates scar tissue over the nerve, and essentially then that allows it to bed in and not move. So one you go underneath muscle and one you go on top. The only real similarities are the fact that they both create the same scar.
And also as well, in terms of duration time, they're pretty much the same, maybe 1 week apart if you get submuscular within my experience. There are 3 really important common sense things to do straight after surgery. And it's amazing how many people actually don't do these. And I'm always telling off people that have had rehabilitation with me for not doing the basics as well as their rehabilitation. So obviously this comes down to keeping hydrated, eating well and sufficiently, making sure that you rest enough, and finally the option of having supplementation to help the body. So let's go through rest first. Your body's just gone through a major trauma. Essentially, without trying to be too graphic, skin's been cut open, fascia's been cut open. In the case of submuscular, you've had a muscle detached and reattached from the body. So what you want to make sure you do is rest. Completely give your body and your immune system a chance to catch up. Your body's going to feel absolutely battered. You're going to feel really tired, really lethargic. Your body essentially is going to go straight into a recovery process. And just like if you was ill, you'd be recommended to rest. It's exactly the same after any type of surgery. Give your body a chance to try and catch up and recover as quickly as possible. And of course, healing and sleep go hand in hand. We recover most when we sleep, and therefore we want to optimize that after surgery and the weeks and days beyond after surgery. Now, hydration is really important, not only for staving off infections after any surgery, but also to make sure that you're ridding the body of any anesthetic, any toxins. Just make sure that you're drinking above and beyond the normal recommended amounts of water. Then finally, nutrition. Now's the time not to worry about gaining weight or trying to lose weight. This is the time to try and eat as much as possible, lots of protein that's going to help the building blocks for recovery, as well as a lot of energy. Your body's going to use a ton more energy than normal trying to recover your body. So you need to put that back into the system. So that's something that's crucially important, something that I tried to maximize on surgery number 2, and it made a massive difference to my recovery time. Now, some people, especially the athletes, that absolutely want to be back as quickly as possible, same for some people that are self-employed, they decide to take external supplements to speed up the recovery process. Now, I won't go into them now and drag the video on so long, but what I will do is put them in the description of the video. I'll put a little reasoning of why I had them and how it kind of helped me, but also as well, how it can help you if you did want to look into the supplements I took. Absolutely you can, but I should mention that they are absolutely optional and you don't have to take them. Your body will recover itself. It's only if you're absolutely under time constraints that I would even think about it. Now I want to get on to some of the actual exercises and rehabilitation that you can do and the time frames of which I started doing each exercise. Let's get into it.
After resting for the first few initial days after surgery, at day 3 you can start to work on your motor skills. Remember, the first initial phase of rehab is to regain strength and dexterity of the hand. For your first exercise, touch your thumb to each of your fingers and try to repeat this process several times for 1 minute throughout the day. This is the only exercise I would recommend until 7 days have passed post-surgery. Once 7 days have passed, you can start to add some resistance to your hand exercises. I like to use putty for these exercises. There are 3 great exercises that you can do to work on your hand dexterity, and first up is squeezes. Take the putty in your hand and squeeze with your fingers into the putty, then use your thumb to reposition the putty. Once 1 minute has elapsed, have a break and then move on to the next putty exercise. The next exercise is pinches. This time take a smaller amount of putty, then squeeze into the putty with just the tips of your fingers and thumb. Once a minute has elapsed, you then move on to the final exercise. The final exercise is finger scissors. This time you roll the putty into a small ball, which you place in between your fingers. Then squeeze into the putty with your fingers, and once fully squeezed, move on to the next finger until 1 minute has elapsed. You would do all these 3 exercises back to back with a little rest in between each for 1 minute from day 7 to day 14 every day for 3 times a day. These exercises not only strengthen the hand and work on your hand dexterity, but also put the forearm flexors and extensors into work too. Once 2 weeks have passed, we can start to work on the forearm and hand further. you can progress onto a digiflex to continue to work your hand and finger grip. These are particularly useful as every finger is trained down to push at the same speed and resistance. You can also work fingers that may be lacking in strength individually. Work up to doing 3 minutes on the digiflex, varying your grip and the fingers that you grip with each day. Next, we have wrist curls. You can use a dumbbell like I'm using, or you may want to use a household object instead. In this example, I have my hand off the bench and I'm working my forearm flexors as I have my hand palm up, then lower the wrist down, then use my wrist to activate my forearm flexors and bring the dumbbell towards myself. The opposite occurs to work your forearm extensors. Here you can see my hands are in a palm down position. I still lower the weight under control, but as I contract my forearm extensors, I'll feel this at the top of my forearm as the weight is lifted towards my body by my wrist. Do both of these for 3 sets of 15 repetitions every other day. Finally, we have ulnar and radial deviation. Here for ulnar deviation, you can see I'm using a dumbbell again, but you may choose to use a water bottle or stick for exactly the same result. I'm gripping one end of the dumbbell and I'm using my wrist to go into ulnar deviation. You can see the weight lift up as I work my wrist in the direction of my pinky finger. For radial deviation, it is much the opposite. I still grip one end of the dumbbell, however this time I'm gripping the opposite end of the dumbbell and the bulk of the weight is positioned in front of my wrist. I then move my wrist in the direction of my thumb, moving the dumbbell towards my body. For both exercises, you would be working up to 3 sets of 15 repetitions every other day. With all the exercises we've covered, remember that you're working up to the repetitions and the sets, not immediately doing them, and don't worry if you can't complete the repetitions and sets straight away. You may also decide to do your forearm extension and flexion exercises on one day and then your radial and ulnar deviation exercises on another day if you want to break up the sets and give your forearms a bit of rest rather than doing 12 sets all in one day. At week 4, we can begin to do banded above the head ulnar and radial deviation, which is far more challenging. This is because we now have to do both ranges of motion with a bend at the elbow joint. Also, the band adds more resistance than what you was previously doing with a dumbbell. For this exercise, I want you to complete 2 sets only on both radial and ulnar deviation, working up to 15 repetitions. Next up, we have tricep pull downs. The tricep muscle works to extend the elbow at the elbow joint. To start, I face the cable machine and place my hands on the rope of the cable attachment with my thumbs at the top of my hand. Then I brace my abdominal muscles and pull the cable down slowly and apart and finish with my hands either side of my thighs. I exhale as I return back to the starting point using a controlled, slow movement. Try not to crash the weights and aim for 3 sets of 15 repetitions 3 times per week initially before dropping down to 2 sets eventually. If you do not have a cable machine, you can use a band to do this as well. Next, we have a reverse curl. Again, I'm using the cable machine here, but you can use a dumbbell for this one too. Stand with your torso upright while holding the bar attachment that is attached to a low pulley using a hands down overhand grip at shoulder width apart. Make sure that you keep your elbows close to your torso. This will be your starting position. While holding the upper arm stationary, curl the weights while contracting your biceps as you breathe out. Remember, only the forearms should move. Continue the movement until your biceps are fully contracted and hold the contracted position for a second as you squeeze the muscle. Slowly begin to bring the bar back down to the starting position as you breathe in and ensure you keep a straight wrist throughout the movement. Aim to complete 3 sets of 15 repetitions 3 times per week, then drop down to 2 times per week eventually. For the final exercise, you'll be in exactly the same position for cable wrist curls. You can see that I have the low pulley set in exactly the same position with the straight bar in my hands, but this time I have an underhand grip, unlike in reverse curls, which you just saw. I curl my wrist towards my head, keeping my arms by my side, and I do not bend the elbow. You're aiming to complete 3 sets of 15 repetitions, 3 times per week initially, before dropping down to 2 sets eventually. Everything I've used in these video demos will be discoverable in the description of this video.
What I thought would be really beneficial to end off this video is to do a quick Q&A, question and answer, where I go through and answer some of the questions I wanted to know prior to my surgery, also as well during my rehabilitation. I've also emailed all my clients that have gone through the full rehab with me and said, have I missed out any questions? And they've gave me some cracking questions to include in this video. So let's start off with question number 1. When could you go back to driving and when could you go back to work? So I was back driving at week 4 post-surgery. I was able to fully extend and flex the arm at that point and my inflammation had gone down. So absolutely fine to drive at week 4. When could you go back to work? I work as a self-employed personal trainer and going from 0 hours to 50 very, very quickly and returning back to work at week 3 was definitely the wrong move to do. I went back to work too quickly. My energy levels weren't quite there. And if I wasn't self-employed, I would have asked for 6 weeks off work. So if you are PAYE or your company is going to pay you for being off, 6 to 8 weeks is probably what I'd recommend. If you're self-employed, possibly maybe more 4 weeks, but the longer you can give yourself, the better you'll be when you return to work. When I did return to work, I was still wearing a sling. I didn't actually have to, but it was more a case for me as a personal trainer. It was that prompt to not pick up a heavy weight or for people not to kind of hug me or say welcome back and pat me on the arm. Anything that was gonna put people off touching the arm or being able to injure me was one of the reasons why I had the sling still on. When could you fully bend the elbow? It would have been week 4 that I was able to do that. Did you have any trouble sleeping? I didn't have any trouble sleeping. I'm a side sleeper and I toss and turn in the night. So for me, I didn't have any trouble falling to sleep, but what I did have is irritation that I couldn't then sleep on the other side. It was too uncomfortable, but it wasn't too bad. I think front sleepers would probably be most affected. If you can only front sleep, then you might have some trouble sleeping. Did you have any muscle wasting? I did. I had some really quite severe muscle wasting of my left arm, specifically the bicep, tricep and shoulder. They were noticeably smaller than my right arm when I was back to training. It only took about 2 to 3 weeks of normal training to get that evened up, but it did take quite a long time to get the strength back in my elbow. So the muscle wasting was resolved really quickly. The strength took about 6 months to get completely even from one side to the other. I might be able to lift a certain weight, for example, and whilst the right side would be as smooth as silk, my left side, whilst it would be able to do the weight, would be a lot more twitchy and a lot more a lot less fluid in the movement, shall we say. After surgery, can you move your hand and did you have any sensation? We've kind of covered this, but I could move my hand slightly. I wasn't able to completely do a clenched fist. And when I touched my left hand with my right hand and went like this, I really couldn't feel anything. It was completely numb. I remember in my first surgery that really freaked me out, but in my second surgery I kind of knew what to expect. After 3 or 4 days I was able to feel and have complete sensation of my left hand, and also as well I was able to grip as well. How did you know that you needed ulnar nerve transposition surgery? So for me, I was doing boxing at age 16 and I threw a punch and the ulnar nerve popped out of its socket and started, as I would bend the elbow, it would pop over, and when I'd extend the elbow, it popped back into the groove. So that's when I knew something was definitely wrong. I got misdiagnosed quite a few times before I actually got a general conclusion that it was ulnar nerve dislocation and it was subluxing over the medial epicondyle. What classification of doctors did you see? I saw a lot of people before I got fully diagnosed, and the full diagnosis was from an orthopedic surgeon who said there's no point in doing any physical therapy because once you've subluxed the ulnar nerve, it's not going to go back unless you do an operation. So that's why I had to get surgically operated on at age 17 because it wasn't ever going to get any better. Did you take painkillers after surgery or need them for the weeks onwards? No, I didn't take painkillers at all actually for both surgeries. I was given cocodamol, and that was if I needed it, take it. If you don't take it. I didn't need cocodamol at all to be able to sleep or anything like that.
I was absolutely fine. However, a lot of my patients have needed cocodamol for the first couple of days post-surgery. So I guess that really does depend person to person. When did you start hitting the gym properly and going back to your normal routines? I would say week 6 after surgery. And that is my normal routines, but with a much lighter weight selection. When did the swelling decrease at the elbow? For me, week 4, so end of week 3, start of week 4, probably when actually I went back to driving. So that was the point in which I could fully extend and flex the elbow. What I would say with the inflammation and swelling is I've had some clients that it's been really bad and it's taken up to 2 months, but I've never had a client beyond 2 months still be completely swollen. You get a really tight feeling around the elbow to begin with, and it kind of feels like you'll never get full range of motion, but every couple of days there's a little bit more degrees that you'll be able to get. Do you have any regrets post-surgery? No, absolutely not. I think for me it was a shame that the surgery didn't work the first time, but it did work the second time. It would have been fantastic if I wouldn't have had to have the surgery twice, but for me, I don't have any problems at all with my left elbow now. I don't have any pain, pins and needles, tingling, numbness, not even for a split second. So absolutely not. It was well worth doing for me. When you're weightlifting, is there anything different you do now to when you before had surgery? So before you had surgery, I think the main thing for me, I would say I'm more conscious about the elbow. So for anyone that's watching this that lifts weights, anything like skull crushers or any movements that put a lot of shearing force on my elbow, I completely avoid. It's not that I have any fear that the ulnar nerve's gonna have any problems, but it's more a case of I don't like to put psychologically my elbow through that load. So I don't also want to get the same problem on the other side in future. So for me, I do bigger warm-ups now on my elbow. I can do a lot of exercises I couldn't do when the ulnar nerve was subluxing, so I'm able to do more now than I could before I had the surgery, that's for sure. Where can I find the products you used in your rehab? So I'll put them all in the description, just like I said earlier with the supplements, but that is all the questions. If you feel like I've missed out on anything, pop me a comment in the comments box of this video, and what I'll do is I'll get back to it in a couple of days or as quickly as I can. It's really, really important for anyone that's got, even if they think it's a silly question, to just pop it in the comments box. I'm more than happy to answer them, it's no problem at all. If you're in the southeast of England and you want to go through an ulnar nerve rehabilitation with me in person, go to my website www.ukfitnesshub.com for more information. If you learned something new in this video, like and subscribe to the channel for more free and educational content. You've been watching UK Fitness Hub. I've been Travis Tarrant, and I'll see you in the next video.